Hello, hello. Please have your seats, please. We are about to start. Before we can start the program, we want to call certain institution to please take this front seat. Last Mile Health, Clinton Foundation, Mother Patton, Plan International, FHI 360, CDC. And WHO, WHO. Okay. Now, before we start the program, we want to have an opening prayer. Someone who is very powerful, because we are very happy today. Yeah. So,
Sure, anyone going to lead a healing ministry? Let us stand for prayer. Father, we thank you this morning for bringing us together. It is our prayer that you lead this section in a special way, that whatever we have planned and ready to execute, glorify your name. In Jesus' name we pray.
that is very powerful. Health professionals, Bowl website launch. It's not easy, oh. We are all professionals, so we'll do everything professionally. So we want to have opening remarks. As I said, don't go more than 1.5 minutes. We are very professional because we want to go fast. So we call Liberian Medical and Dental Council for remarks.
Good morning to all. Distinguished guests here present, members of various health professional boards, one and all. I come from the Liberian Medical and Dental Council, currently serving as the chairperson. And just to briefly state that the Liberian Medical and Dental Council is the umbrella body of all of the health professional boards in the country, and we are responsible to license all health workers, register all health workers, also adjudicate cases of medical malpractice. We are set standards for medical practice. So this is a big win for us today, that we are able to launch our various websites for visibility, that people can stay miles and miles away and get to know about the various entities without having to come to where we are. It's also a big boost in the direction of continuous professional development as a prerequisite for licensing. So this is a milestone program for us today, and we are over elated to be a part of it. We want to thank all of the boards for taking part in this program, and want to say a big thank you, particularly to Bridge U and the UC Project, for affording us the opportunity. So thank you very much and enjoy your stay.
Okay. Actually, I don't want got a master program sheet, so something you might not see on your own is on mine. So don't be surprised. We call on Liberian both for nursing and midwifery.
Our partners in health that we always called on, especially Bridge U, our magical partner that have brought our dream to reality today, all of our government officials, if we have any in right now, our health workers, and I love this, health professionals. We are excited today for a dream come true through the efforts of Bridge U and all other regulatory agencies in the health sector. Let's please clap for ourselves. To have our efforts of making CBD a reality for every health worker in the entire country to come true today is a big, big blessing for us in the regulatory sectors. And all we've come to say is thanks to our support base and to assure you that we are ready to run and sustain whatsoever gain you have given us. Thank you.
Too powerful. So we call on the pharmacy board.
Thank you. Good morning. Our partners and stakeholders here this morning, we want to say we are excited as a regulatory body for the practice of pharmacy in the Republic of Liberia. So as we come here this morning, I see two major components of our gathering here. I see a website being launched and also the CBD. It is no mistake to say information is only useful when it is accessible and visible. So I believe by setting up the websites for all of these regulatory boards will make it easier for us to disseminate information and that people can have access to what all of the professionals, all of the practices that are done in our healthcare delivery system are made visible and accessible. So for us from the Pharmacy Board, we are very excited. This is a great milestone. And also talking about the CBD. If the information that are available are accessible, it is only good enough that we make use of the information to improve the practice that we carry on in the healthcare delivery system. So within, by instituting this CBD, all of us as professionals will continue to build on what we know and the information we gather and improve our services. So we want to say thank you to our partners and all of the stakeholders. And let it not just be an event today, but let it be a process so that we can improve on the services that we provide in Liberia. Thank you, and God bless you all.
Thank you very much. So powerful. Liberia Environmental Board representative. Liberia Environmental Health Board.
Our partners, distinguished professionals, like the other speakers have said, we are very grateful and excited to be part of this historic moment. To have a website as a health professional is great, and it's going to enhance our work, especially in the areas of information dissemination. We say thank you to the team that have done this great work, and we count on you for your support. Thank you.
Thank you very much. As I said, I'm the one in charge. So the jingle, I will skip it small because the word in that jingle too powerful. So Olivia will come to it. So we'll come to the loud people. the soothsayer, they get call say, you go call this say, then you go do a sacrifice.
Good morning to all. Well, as previous speakers have said, this is a wonderful day for us. You know, when you do a piece of work, whether bad or good, you have to let the public know. And I think by this means, the website will be able to reach places that we cannot walk to. And so at this point in time, I want to thank the committee that worked with Bridge U to have our website established. And Bridge U, we're still on your hair. Just be sure that we're always back at your door. Thank you, and may God bless all of us.
Thank you very much. That's so powerful. Limpa. Limpa.
Good morning. On behalf of the PA Board, we want to use this time to say thank you to Bridge U and the UC family for the support. We consider this particular moment as a massive achievement for our board and our association. We can assure you that our website will be sustained, it will be protected, it will be used for the intended purpose. Thank you so much.
That's good. Now we have come to one of the most important items on the board. So I would like to call representative from the various boards to please come here for the official launch. Representative for the various board. As That was so powerful. No comment. So powerful. So people are seeing the Bureau website. So let me use of them. Let me make sure that we use our paper base. So many writing. So just go to the website and just do your application. You will cut down cost for motorable accident. So our next, we have reflection and recognition by Shelley S. Famble, senior coordinator.
Good morning, everybody. Wow. Today is a wonderful day for every one of us, seeing that we now have all of the health regulatory boards with a functional website. It's been a long time coming. We started in 2022. We went to the antenatal, and then they told us we conceived. And after the midwife did her checkup, she told us that there was a single baby in there. And then we continue going to antenatal, taking medications, doing everything that she wanted us to do. We went back for checkup, and surprisingly, she said it's multiple pregnancy. Meaning, we started off wanting to review and revise the national guidelines for CPD that was developed in 2017. After we did our capacity assessment to find out where the different boards were, we got to realize that it was under the Labrador Board of Nursing midwifery that had a functional website. So that gave us another debate in neutral. And then we started working. We worked all hours looking at the old guidelines, copying from other countries, seeing what they were doing there, looking at best practice from the region, from other countries outside of the region. And I mean, it was just a lot of work. Is Dr. Kuya here? Dr. Kuya, please come up. Dr. Kuya, at that time, he was at the Ministry of Health, working in the Department for County Health Services, and he was the lead on in-service training. And if you ever have to work with Dr. Kuya, know that even at 12 midnight, you have to answer calls. I remember on one occasion that Dr. Kuya called me by 10 p.m. and my daughter is like, it's after working hours. I said, no, I have to answer this call because we really wanted to make sure that we did our work on the guidelines. We had the guidelines running and that we had a website established. So that Akuya, we want to say thanks for all of the work you've done. We're so proud of you that you were part of this process. Not forgetting all of the regulatory boards. And I remember on one occasion where we got information from West Africa. Mr. Brown said, let's look at East Africa. What are they doing there? And then he got some documents for us. So, I mean, it's been a long time coming. And we're trained with all of the enthusiasm and everything that we put into this. That is why we are here today. Now we got our national guidelines. In 2017, we had 3 regulatory bodies, the LMDC, LBNM, and the Pharmacy Board that wrote that guidelines. So during the revision, we added additional 3 boards. So now we have the 6 regulatory boards in the Republic of Liberia that are part of the guidelines, and they have agreed that as of 2025 April, if I am going to renew my license, I should present certificate with CEUs that I have completed some form of CPD. That is best practice. And we are so happy that the Ministry of Health has given us the blessings. So we are not doing this alone. We have backing behind us. We have the Ministry of Health that is pushing us and making sure that it's done. To our powerful communication team, Jenny and Peace, could you please come up and let's give them a round of applause, please. Jenny and Peace, please come. Please come, please come. So we provided the information that they needed, and guess what? When we started work, we assumed that we're going to do the work under 6 months, right? But we did it more than 6 months. And Jenny and Peace did very, very well. So all of the things that you see here, what you see on the website, that you can now go to the website and apply to be a CPD provider, it all came from these people. So we are very happy that you work with us to ensure that we got what we wanted. Thank you ever so much. Yeah, you can go, please. Thank you. So the rest of the regulatory bodies and the partners in here, we're so thrilled that now Liberia can say that before you renew your license, you have to do some form of training. We're so happy about that. It's no more once a nurse, always a nurse. No, you have to upgrade. So even if you are not at the bedside and you are in administration, you still have to upgrade before you get your license renewed. We want to thank you ever so much. We have our fact sheet for would-be CPD providers. If you're here and you're running training, Last Mile, Child, CDC, Plain International, we want you to kindly get in touch with the various regulatory bodies so that you are approved. We have our fact sheet. If you want the fact sheet, you can please get in touch with Lyda and get a copy of the fact sheet so that you know the steps to follow and what to do. Once again, we want to say thank you. It was really a wonderful time working with you, and we're looking forward to doing much more to ensure that the regulatory boards are strengthened. Thank you.
Thank you very much. Yeah. Before you renew your license, you gotta go to school. The school better not come again. People who left school way about 30 years ago, they think people want to do something. Anyway, it's good for everybody. We got to improve our skills and clinical skills while we're serving humanity. So, as I said, working within time given. So we asked Jenny to make remark for Dr. Dan. Oh, okay.
Good morning, everyone. It's a great day for Liberia, especially for the health system. And I want to be grateful to God that it is at the College of Health Sciences this program was born and nurtured up to this point. So we want to give a special recognition to the Bridge U coordinator, Lalake, for the wonderful work you did alongside the various regulatory boards. So thank you all of the boards that are here today for this launch. We believe that forward movement from this launch today will really put Liberia on the map, that everyone can see our various boards and they can see the functions and whatever work they are doing. So thank you very much. So I'm sorry for being taken by surprise. I saw Dr. Dan on the list, and then just a moment ago, I was asked to give this remark on her behalf. But we are happy that you are here at the College of Health Sciences. We welcome you, and we hope that all of the work done today will continue for the prosperity and the health of our patients. Thank you very much for coming, our partners in health, and everyone who contribute to the success of this launch, of the website launch. Thank you so much.
Powerful. Another remark by USAID representative. Anybody from USAID? Minister of Health. Clinton Foundation.
I think we need a big hand clap for this. So I'll I'll be speaking as country director for Clinton Health Access Initiative, but I'm moved to also speak as former president of Liberian Medical and former president of Liberian Medical and Dental Association. So Clinton Foundation is a partner to the Ministry of Health. We continue to provide technical assistance dating back from 2006. So our mark is everywhere, being very, very trusted, credible partner. I want to say we'll remain to do that. And on this landscape, I want to take this time to appreciate the bridge you for the work because this has been coming, but it took some time. And now today we can see that it's not always that it comes faster, but slower and very sure. So thank you all for this work. On the part as former president of LMDA, I think this has been something that we started off even before forming the LMDC. Now, I think we can say that what work was done in the past has finally come to this point. So I'd like to take this time to thank you and just caution us, because a website doesn't say anything if there's no content. And it's important if we have the right content that is provided on the website, because there are a lot of things happening. When I went to medical school, I did prescribe oxygen and everything, and today it's a different ball game. You have to, and disease epidemic have caused us to learn new things. So I hope the professional development that is going to happen will bring on new training materials that you might not find in the curriculum. And this is important because we need it, and we need to brighten ourselves. And I like the fact that now all the boards are going to hold everyone, even us in the administrative, that we must provide CPD, points to be able to get our license. Thank you very much. This is a very good work.
Last Mile Health.
So I also want to add my voice to that of Dr. Masakwe to say this is extremely amazing to see happen. As someone who has some foundation from the Liberian Medical and Dental Council, this is something that we actually prayed for. We started the process. It was a very long road, and now to see that it's finalized, a website is up and running, and it has a future for CPD also connected to that website. We think this is laudable. So my name is Likele Temi. I'm the medical director of Last Mile Health, representing Dr. Maran Zuba, who was actually supposed to be here. But I can tell you that if she hears about this, she's currently not in the country. She's going to be so excited because she's one person that has really taken the issue of the boards and the different associations really deeply to her heart. And all of the different representatives here can attest to her support, her continuous support to ensure that the boards are in the place where they can adequately do their job. So for Last Mile Health, we are on the standby to collaborate with especially the CPD initiative. For some of you who don't know, we have a community health academy. Is an online, is a well-structured online training facility that will not just only be helpful for just last mile health staff, but also middle level healthcare workers interested in knowing more about community health, and especially those of our nurses who have transitioned, or nurses or other cadres who have transitioned to public health and other um, management professions. So this is something that we will definitely follow up with you and ensure that we're able to collaborate as well to ensure the success. Thank you very much.
Play International.
Good morning, everyone. I bring you greetings from Plain, my country director, Miriam Murray. Standing here, I'm Lawrence Medi, I'm the ITT manager. No, she's so engaged, and then when she saw the letter, she said, Lawrence, you have to go there. So honestly, as a citizen of this country, I'm very excited to see that we as Liberia, we're taking a very great step. And I must let you know that we are in the 21st century now. Those days, you have somebody that have all the history of our country. You have one old encyclopedia in the library where you got to stay in line to be able to check to get the references. But I must tell, even our kids coming up now, they don't know that again. So if we pray 500 times, if we don't take this action, we will not make progress. So I think that's the best path you guys are on. And from an ITT perspective, I must tell you that I'm happy to be here for one reason, to also tell you that it's easier to put the website up to show you for others to see it, but work has to be done. And we have to ensure that information, like one of our speakers said, they are accessible, they are available, not just to us partners or donor or whoever. And everyone in this country should be able to have access to this information. And I think if you come into partners, to people that are supporting you, these are things you should start coming with. Those our 15 counties have internet. Everyone that to do the health facilities, they have access to this information. It should not only be centered just around Monrovia. And if we take that as a national priority, I think we can move forward. And I must tell you that at Play, our goal is to see girls, young people, young children lead, desire, and thrive and take leadership. So we cannot lead our young generation without internet intervention or without the accessibility of resources. So thank you so much on behalf of my country director, who is my boss. She bring you greetings. She couldn't be here because she had a lot of engagement with so many partners now to speak. But as an IT person, I must ensure anytime I see such a things like that, I will also be on our neck. Thank you.
FHI 360.
Thank you very much, and good morning to everyone. My name is Nana Fuswa Clement, and the country rep for FHI 360 Liberia and the EPIC project director. We are very excited to be here and to be part of this launch. And most especially the 6 partners that formed this. We are working directly with 3 of them. Our focus in Liberia is working with 27 health facilities in 4 counties on HIV/AIDS. We also are working on education with education projects and some interventions under global health securities. We are very sure, we are excited and very sure we are going to continue with this collaboration. The pharmacy board, they are here. The nurses, the board for nurses and midwives, as well as the council itself. Thank you very much for this and we remain committed with our partnerships. Thank you.
CDC.
Okay, I'm here on behalf of the United States Centers for Disease Control and Prevention. That's the US CDC. So, my name is Gulu Gwesa, and I'm the lab lead for US CDC Liberia. And I will add my voice to other voices to commend the launch of this. And this is a milestone. I know this, I don't want to say you may not know, but because I know Shelley and a few other folks I also have also worked in the health sector, so they saw the need to have this put together and launched. Because from our own end, even from the support we provide as USCDC and as lab folks, there has been gaps. There have been issues with, accessing some key data, especially for instance, if you go back to EVD, COVID, and by the time you want to say, oh, who are the lab folks at this point, you have to start relying on somebody's information, right? So if Dr. Mataka does not remember that lab folk, that piece is missing, right? You might know procedures for licensing and what have you. All of those are just kind of in a box, wrapped up, right? But this website goes a long way in that these informations are there. You can easily access, you can easily reach out to the LMDC. And I'm very sure, I'm not told to say this, but I'm sure the LMDC at Bridgeview are open to suggestions. I know it took time to build this up, but I'm sure they're still open to our suggestions. And I like the second to the last slide. It ended by saying we are alive. So us in this room, I charge every one of us to keep this vision alive. Thank you.
Mother Patan College of Health Sciences. Okay,
Fox says I'm representing the Ministry of Health. All protocol observed. As you know, I'm almost the elder. I've been in this country 48 years. 48 years. And slowly but surely we're getting there. And even for me to maintain my license in the States, you have to do continuing education. You have to do it. And I'm in education. And all the training we do, it changes every day. We know that. So this is a beginning. And the thing is, continue. Opening something and launching something is just the first step. And part of our problem here is to continue. Make sure it works. So this is where I'm sure you have all of our support. And I said, thank God there's not 12 chairs here because we'll all be talking all day. Thank you very much.
That's powerful. National Reference Lab Director.
So thank you, and I don't know the time. Good morning once more. So my name is Fan M. Tower. I serve as the director for National Public Health Reference Lab, and I think this is a good initiative from the health background and perspective. So on behalf of the National Reference Lab team, we look forward to working on the CPD, which is a key aspect of any laboratory system. Especially for the laboratory system, continuing education, the use of technology. We have a lot of new technology and innovative that come on a daily basis. So we think this is a good initiative in the process. So now to boring up with time, I want to say thank you, and we look forward to working with you to make sure that we have more and more continuing education in terms of our professional career move forward. Thank you.
Thank you very much. Jingle. So before we go to the last one, we want to play our jingle. So please listen to it carefully. want to call the RDDS representative. Ben. Yeah. From there, all the liaisons that really contributed towards the development, please count us that so we can recognize people and clap for you.
Thank you. All protocol observed and sustained. Firstly, let me begin by bringing greetings from the team lead for IDDS, Mrs. Ellie Minumu, who I love to be here, but because of some engaging schedule, she asked me to process for her. We want to say thank you to the Bridgeview family for this massive work. I remember in 2019, when I didn't serve as the president of the Laboratory Association, we embarked on similar ideas. Many of you here can attest to it. And the young brother, the doctor, said that Dr. Zuba was the brain behind that initiative. We are grateful that whatever we started in years back, we are on path to sustain Liberia. What makes this CBD very important in the launch of the website? For me, as from the laboratory background, we are into the field. And some of the challenges we see, like one of our speakers mentioned, is that we are in a revolving time where the sciences are changing. So to be able to be on par with what is changing, we need this CBD as a continual reminder for our staff who are graduating right now. I'm very grateful to be a part of this occasion and to see the launch of this happening. Thank you very much.
So, as I said, there were liaisons who really contributed towards the development of CBD. So, one them to come outside here, so you'll see them. The liaison from Nesimbo. She there. The liaison from Nesimbo. The liaison. Yeah, we'll take it by force. What a PA, man. Please come. We'll fetch all of them out. So, as people can see, these were the people that were sent to develop, to work along with Bridgeview to come to this level. So we have to what? Congratulate them for the hard work. Are there too? Okay, so thank you very much. You can have your seat at least. Okay. We got to call at 10:13, but I don't have at 10:13. I got at 10:08. So I don't know. Should we have a reduction and go to something? So for now, we have snacks and networking. So let me turn over to what do we say? Shelley, please, 1 minute here. You all are spread here. I gotta sit down to eat. I'm gonna be talking there. All the group part and go.
Hello. So it's time to network. Yes, it's time to network. Networking is so very much important. You have CDC, you got Last Mile, you got Play International. So come and meet these people to tell them what your boss doing, what you're thinking about doing. Then after that, we have our snacks. Come, please. Can you put the website addresses on the board, please? Thank you.